Good day, everyone. It's a very nice feeling to be here today. Thank you to Monica and the Bayer Foundation team for hosting such inspiring and collaborative event. So I am Elzara Jamieson, CEO and co-founder of M2Mad, and I am here today to talk about what we do in this world where 500 million people are pushed into extreme poverty every year due to health care costs. And many more forgo care, and when it comes to pregnant women, that can be fatal. Each day, 800 women are dying from preventable pregnancy and childbirth complications. In Madagascar, the country where I'm from, less than half of births are attended by skilled health workers, and 15% of pregnant women do not receive antenatal care at all. And it's not just about a lack of funds, but as well a lack of mechanism and tool to save money and to make it available when it is needed. That's where M2Mad that's why M2Mad built the mobile maternal health wallet. So it's a digital wallet accessible via a SIM card, allowing pregnant women to save money and to get vouchers for antenatal care and to pay for delivery expenses. And it's not just a wallet, the wallet is part of a larger digital platform that handling saving, management of claim and payment. But how do we reach our target group for pregnant women with irregular and low income who usually don't own a phone and are unfamiliar with mobile technology? And as you have probably guessed, it's where the community health workers come into play. The community health workers are our enablers for tech. They are our enablers for tech in three ways. So they boost awareness. They boost awareness on the importance of getting care in health centers and the importance of saving for health. They bridge access gap. So we distributed SIM cards, and the pregnant woman could use them in anyone's phone, including those of community health workers. And they build capacity and trust. They teach women how to use the mobile phone, and they become more comfortable using it. And our approach has proven to be successful. Within 2 years, over 11,000 babies were delivered safely, and the costs were paid over the mobile health wallet. And the key factors for this success were that first, the community health workers themselves were convinced about the tool. They said, especially for women, they aren't always supposed to depend on men. It's better to always have something for yourself. So it's a nice empowerment tool. And they were as well compensated for their work. But how do you deliver compensation for health workers where they are themselves living in a remote and dispersed area? That brings me to our new initiative aiming to tackle the high rate of unvaccinated children in Madagascar. In Madagascar, in southern Madagascar specifically, 1 in 4 children are zero dose. That means that they have received none of the essential vaccine that could prevent them from getting ill. And for example, now polio is back in Madagascar. But to reach these children with this new project called Swameva that is implemented by doctors from Madagascar together with the Ministry of Health and M2MAD, and which is supported by the Bayer Foundation and the Gavi Vaccine Alliance for a match-funded model. We want to reach 40,000 zero-dose children, but to reach them, we need first, specifically the community health workers, will help to identify them with their location so that the vaccines are available at the nearest health centers. And secondly, the community health workers have to generate demand from the parents that they are interested and willing to get this vaccine. In many countries, the community health workers are not paid for their work. In Madagascar, they usually receive what we call per diems and stipends. But according to preliminary studies, 60% of community health worker households earn less than $20 per month. So in this initiative, Doctors from Madagascar will implement a new way to compensate community health workers. It will be a more structured and regular monthly payment. And what M2MAD will do is to develop the tool to collect the proof for sensitization and referrals that they have done and to manage the payment. Now, M2MAD has expanded the maternal mobile health wallet in other regions in Madagascar that are even more remote. And we have as well implemented a variation of the wallet in Uganda and in the Democratic Republic of Congo. And we are as well exploring more collaboration to strengthen the community health workers and as well the community that they serve. Thank you. So now it's my pleasure to introduce Miriam Courtney. Miriam is Brac's Foundation Lead for Europe. Brac is sovereign-led international development organization founded in Bangladesh that partners with over 100 million people living with inequality and poverty to create opportunities to realize human potential. Brac has a community-led holistic approach and strives to deliver long-term impact at scale. Miriam, the floor is yours. Thank you.
Thank you. Hi, everyone. I'm Miriam Courtney. I'm the Foundation's lead for Brac. It's really great to be here. So thank you very much to the Bayer Foundation for inviting me to speak today about community health in the Global South. This is a key part of Brac's work. So yeah, very honoured to be here to speak to you all today about it. For those of you who don't know much about Brac, let me give you a brief overview. Brac was founded almost simultaneously with the country of Bangladesh itself in the 1970s. It started as a small humanitarian relief provider, and it's grown into one of the largest and most effective NGOs in the world, and the largest originating from the Global South. Brac now partners with over 100 million people. Brac is built on the understanding that local leadership and local knowledge is key to development programming, and that those with lived experiences are best placed to understand the context and the solutions. Brac also believes that in order for there to be real and sustainable and lasting change, this has to be done at scale. So Brac works in Bangladesh, obviously where we started, but also working in 12 countries across Asia and Africa. And we also partner with 9 governments providing technical assistance. So a bit about Brac's health programming. As I said, this is central to Brac's work. So some stats here. Brac has reached 118 million people through our services. But I think it's also important to take a step back and understand, how did Brac get to this point? So when Brac was formed in the 70s, the key aim was to make Bangladesh a sustainable country. And for a sustainable country, you need a healthy nation. So health became a key pillar of Brac's work. So in 1972, Brac opened 4 clinics in northern Bangladesh. However, most of the doctors and the health workers there were mostly men. So Brac realised that they were failing to reach the underserved at this last mile because many women didn't feel comfortable receiving healthcare services from men. Brac took the lessons from the Sula clinics and also adopted China's barefoot doctor approach and engaged, trained and recruited local women from these grassroots communities to serve as healthcare providers within their communities. These community health workers, or CHWs, are at the heart of Brac's health work. So Brac now has established the world's largest network of non-governmental CHWs with a dedicated team of over 80,000. So these are locally recruited women, and they provide door-to-door health services. So that could be, maternal care. It could be HIV education and prevention. And they also sell health products as well, such as birthing kits or sanitary pads to provide themselves their own sustainable livelihoods. So we believe these CHWs are absolutely vital to Brac's health work. And this is because of the reach that they have. So they're able to access people that don't normally access the more formal routes of healthcare, so hospitals and doctors. It's also an incredible network to leverage during system health shocks. So COVID obviously being a recent example, Brac was able to mobilize its network and these women went out into the community distributing masks, dispelling health myths, which had a huge impact at scale. And also the access that these CHWs have, they're able to access the community because they're part of that community in a way that just most health facilities can't. In a nutshell, this is Brac's approach. So innovate, pilot, perfect, scale up leads to impact. So there's lots of examples that I could give that demonstrates Brac's approach, but I've only got time for one today that I'm going to share with you. And this is Brac's oral rehydration therapy, or ORT, extension program. In the 70s, diarrhea was a major killer of children. And this was despite the fact that an oral saline had already been invented, but it wasn't reaching these grassroots communities. So Brac pioneered a practical approach to making a simple solution, which was 3 pinches of salt, 2 fistfuls of sugar, and half a litre of water to produce a low-cost, life-saving solution. Brac's community health workers then went out to every household within the community and taught at least one person within that household how to make that solution. And between 1980 and 1990, Brac's health workers managed to reach over 12 million households and contributing to reducing child mortality in Bangladesh by 45%. Digital health is also a really key part of Brac's community health work. We have seen that it's greatly improved the speed that communities can access health information. So during COVID, Brac saw this as an opportunity to really leverage digital technology. So in 2020, Brac launched a new mHealth app to digitize data for over 57 million people in partnership with Empower. So this was a great way to disseminate information and also to enable data sharing with our government partners. And all our kind of community health workers were also equipped with a tablet, so they were able to capture data. So we see this as a really critical part of our work and something that we want to continue to invest in. And lastly, Brac has huge ambition across a number of areas in community health, which I don't have time to go into them all today, but this is just a taster. So strengthening community clinics, integrating mental health and psychosocial support, and a key one for us, addressing climate-induced health issues in climate-vulnerable areas. For Brac, climate is a key part of our work, and it cuts across every single aspect of our work, including health. As the panel kind of spoke about before, this is something that we're really kind of looking more and more into and having to do more and more of. So that, in a very quick nutshell, is Brac's approach and work in community health. So thank you. And I'm now going to hand over to Joost, who is the founder of Healthy Entrepreneurs, which is a social enterprise dedicated to delivering last-mile healthcare services across sub-Saharan Africa. He has a background in business, administration, and extensive experience in distributing essential medicines, and has developed a scalable delivery model for healthcare driven by his ambition and commitment to sustainable development.
Good morning all. It's a pleasure being here. Thank you for having me. I was inspired by Rose, who did some nerding, so I will do some nerding about our work. And it actually starts with a slide that's not mine, but I don't know if Edine is in the room, but I borrowed it from him. Community health is actually key. Why? Because more than 90% of all health challenges can actually be sorted as part of self-care, informal and formal community health, and partly primary care. And I think we all agree that community health is important. Universal health coverage, quality of care, market regulation, digitization, reduce the burden of treating complicated cases by being actually proactive. Getting actually a response to pandemics, but also an outbreak of an endemic like non-communicable diseases. And at the same time, we need to sustain such a system. And actually, it's very easy, because if we train and do refresher courses, if we organize coaching and monitoring, if we have some income-generating activities, or actually some income motivation and a supply chain, there is no problem. But unfortunately, the reality is actually different. Only 12% of all community health workers on the African continent get paid. Refresher courses are given, but NGOs have particular programs and they train on part of the topics, but not a holistic approach. Governments don't have money for it. Supply chains exist, but in many cases the products will not actually continue beyond the health center. And actually supervision is organized, but even the incentives for the ones supervising do not exist. And then if you think about the numbers, Tanzania in 1978, Alma Ata, when we designed the community health systems, there were actually living around, I need to look for the number, there were 18 million people living in Tanzania. Today we have around 69 million, 2030 79 million, in 2040 105 million. And that means that we need by 2030 150,000, 158,000 community health workers. And if you take the whole continent, the same exercise, by 2040 we have more than 2 billion people living on the continent, and we need more than 3 million community health workers actively operate. And now I'm going to do my nerding part. We have costs. To actually equip a community health worker, it will cost us $250 per community health worker per 4 years. And then actually, we would like to provide free treatments. And I've only taken the free treatments for children under 5, which will cost approximately $600 per community health worker per year. And if we then make actually the calculations and we see a monthly remuneration of around $30, which is considered to be fair. The free supplies of $50. And then actually the refresher courses conducted 1 training per quarter, $5 a month. That makes $85 a month, makes $1,200 a year. And if we then actually take the ambitions for just Tanzania, this year we need 104 million to actually pay for the community health systems. And actually in 2040, it's going to be 158 million. And if you take the cumulative budget that's required for the coming 15 years, you can calculate $2 billion. And in the whole continent, the cumulative budget to actually deploy community health workers is $43 billion. And I know Abimbola spoke about some billions he was looking for, but I'm looking for way more billions to actually finance a proper community health system. I think the message is clear. And so this is where Healthy Entrepreneurs comes in. I'm a founder of an organization that has the vision Basic Health for All. But I do not believe that actually it's a donor money that actually is a solution to actually pay for community health. It's actually a supply chain. It's actually, that is a backbone where we are offering products at the cost, the lowest price possible, to make sure that services are available. And that's where there is an investment opportunity for a community health worker. Someone starts becoming part of our network, existing community health workers, not separated from the public system, within the public system, because I believe it should be one system. And then actually we are able to organize a training at the start. We equip, including a phone, including a starter kit, provided on credit, where we will then, once they're actually active and trained, be refreshed every 2 months, where we are able to actually replenish every 2 weeks and making sure that we can generate an income with a full range of products, which is not restricted to the free commodities offered by government, but having what we call ICCM, integrated community case management products, which are curative, but primarily preventative products, working, as what also my colleagues spoke about, on actually personal care, nutrition, fortification, sexual reproductive health, and making sure that those products are closely available. Supported by technology. I'm not going to go in details, I have only restricted time, but what we are able to do is use technology to have an efficient and cost-efficient operation, where we will actually deliver products close to the communities, whereas actually through our unique supply chain, we are able to make sure that products are delivered in a cost-efficient way. And so what we can do, we can make sure that the community health worker will spend around 60% of its time or her time on actually community health, partly conducting the free work, partly conducting the complementary work that actually makes that the time spent on community health is sufficient to build the sustainable system. We will also provide access to credit. I don't know where Tiffany is, but I really would like to actually explore more how we can work together, because there are solutions to actually grow businesses by providing access to credit, and by growing so we are able to actually build business, boost business, but also have a solidarity fund, whereas actually community health workers that are facing an unfortunate financial challenge, they're actually offered credit to continue their activities, continue serving their communities while they're actually recovering and go over the unfortunate event. And so we are building a business case, whereas actually a community health worker can actually increase its income, increase revenue, but most important, to serve more households. And so our model is actually evidence-based. We are able to double income. We are able to organize way more refresher courses than regular community health workers. We are growing self-esteem, probably one of the most important parts of actually the work we do. We have a significant improved availability of the key products, and we are actually financially sustainable. But most important, we are, for the rural family, able to actually reduce the out-of-pocket expenses from actually 15% of their monthly expenditure to around 6% by actually offering services. And then this is what it's all about. Power ladies. Believe me, this is actually what drives me every day, to have actually an income-generated activity for ladies who are actually deploying a fantastic model. Thank you so much. And now Jeff is coming from MEDIC. Jeff, I would like to welcome you on stage. MEDIC is actually a very important organization that really helps to structure and organize registration and actually digitalization of community health work, which is one of the preconditions to actually get more funding in, because once we know what is exactly happening on the ground, we are able to also work on payments, performed payments, and actually on solutions how to better monitor and structure the way of community health workers. So a warm applause for Jeff. Thank you. Yeah.
Hello, I'm a surprise guest, and I do have a timer. I was told I wasn't going to have a timer, and I was just going to go rogue on you. Thank you to the Bayer Foundation and the folks that just presented for continuing the conversation about community health and community health workers. The 3.3 million CHWs around the world save lives, and it's important that we keep talking about them. My name is Jeff Jacobs. I'm the Director of External Affairs at MEDIC. You got to meet my colleague Gareth yesterday, who introduced our organization and the Community Health Toolkit, an open source global good that supports 20 countries around the world with world-class software to support community health workers. You also got introduced to MEDIC from the Million Lives Collective. As was just introduced, we're launching a new partnership with Million Lives, Bayer Foundation, and Dietrich to look at digital payments for community health workers. As you've heard from my colleagues, health workers are predominantly women. And so we're approaching sort of two challenges together. One is ensuring that they are paid fair wages for the work that they do. We know that this leads to better health outcomes for patients and better quality of care. And also, because community health workers are women, we're also advancing women's economic empowerment. So it's a really exciting project and fits really well, I think, with what Bayer Foundation is looking to do as well. Now, for the exciting part, and I know I stand between you and lunch. We're going to watch a film together. This film was produced for MEDIC by BBC, and it features an individual named Maureen. Maureen is a community health worker in Migori County, Kenya. It's in the western part of the country, and she supports over 100 households, providing care to those families day after day in their home. In the film, you'll be introduced to her family, her work, and the brand new National Community Health Worker app in Kenya, which is built upon the platform that MEDIC has built and created over the past decade. At MEDIC and the broader community health worker advocacy space, we have a mantra that goes, no conversations about community health workers without community health workers. Last week, I was in Geneva with Maureen, where she was invited to speak on a number of panels to talk about her work, how she uses digital technology, and advocate for the professionalization of herself and the 3.3 million women just like her. I wish Maureen could be here with me so that you could hear her story right from her own lips, but I am delighted that I can at least introduce you to her virtually via this film. I do hope that you enjoy. It's about 5 minutes long, and if you'd like to continue the conversation, I hope you'll find the MEDIC team and everyone else working on community health workers around the world during the meal break. Thank you so much.
There are some things that I maybe at times I want to forget. I'm a single parent of now 2. Unfortunately, I lost the first one, Miriam, July 30th. She had never been sick. She got married in 2021 December. She got pregnant immediately after their wedding. I just thought that it was maybe the pregnancy that was making her become sick. She was even saying, Mama, if I'm diagnosed with cancer, Mama, I'll fight till this cancer will get out of me. And that's why I'm still holding the babies. I can't let them go. Because if I see them, I still see Miriam. Yeah. It has motivated me. It has now given me a morale to help the sick.
Good afternoon, everyone.
Good afternoon.
My name is Nakasa Were, and I am Director of Community at Med. We build technology for community health workers like you. We have partnered with a lot of organizations like Luala across the country and the Ministry of Health and the counties to develop the app Itches, which you all use. Itches is the electronic community health information system. It is powered by the Community Health Toolkit. That's what Itches is for, is to help you deliver the critical care to communities. But an app on its own will not save lives. It needs to be supported by a thriving ecosystem. 4.5 billion people still do not receive essential health services. Community health workers are important in a country like Kenya. We still have areas that do not have adequate health facilities. Community health workers are trusted members of their communities, the first level of critical health care that a lot of the world's population will ever receive.
At first, it was like, what is it? Yeah, but after the training, we just found that it was one thing. Yeah, everything is packed inside the Itches. Yeah, the household register is there. The service delivery, it's there. Yeah.
It's so important to work with community health workers when we build these digital health tools because they understand their pain points and their needs.
In the past, in the book, like the larger one, I was forced to carry it to the health facility. This one was the first one, my household register. And in 2023, this one, the Itches. I look after 133 households. One could call, Maureen, I have an issue. So I could go there immediately.
Ami HL. Odi.
This is one of the households that I needed to monitor. I'm going to assess her rate. Diana's blood pressure was at times high, so I needed to monitor her well. This household also, I did a lot of follow-up, the newborn and the mother. It helps me as a community health worker because all the informations are stored there.
How have you found spending time with Maureen?
Oh, no. When you listen to Maureen's story and hear how selfless she has been and how she has that loss, power the work that she does, how can we not support that?
We don't want our community to be left behind. And I'm doing it on behalf of my daughter.
Thank you so much.
Thank you, Mama. Thank you, too.
Okay.
I'm okay. I'm okay.
Okay, so I should come back.
Community health workers, we are always there for one another.